Hello cruel world. I recently made a video about Hugh Edwards and how he's been admitted to a psychiatric unit, and that generated a lot of discussion, questions in the YouTube section. So I'm going to clarify in this video about the difference between being hospitalised in an NHS versus a private clinic. If it's an NHS clinic, some patients can go in voluntarily, so they're not under section, they can't be forced medication, etc., etc. But more commonly, they're sectioned under the Mental Health Act. Now, anybody, if they've got enough money, if they've got private health insurance, can kind of bypass the sectioning stage and they can be admitted to a psychiatric unit. The Priory is probably the most famous one. But there's a slight grey area in that because they're paying for the treatment, they can't have treatment against their will because that ethically would be wrong, right? So if somebody needs to be sectioned, so for example, if they're self-harming, if there's a risk of suicide, or for example, if they've got psychotic symptoms like hearing voices, having delusions, but they don't have insight, so they don't want to take medication, then they can't be in a private unit because medication might need to be enforced. So in those situations, they will have to be transferred and sectioned to a mental health unit. Another level of confusion is that there are some private units that do section people, but they're not paid for by the individual person. So you don't pay for those units. It's the NHS that pays for those private hospital beds. So hopefully that's cleared up some of the confusion.